Hello, everyone. How are we all doing today? Welcome to another episode of Correcting Conception, Bad Conception, Negative Conception, and Misconception, and negative beliefs about health. Negative knowledge, trying to correct your knowledge about health, trying to give you the right knowledge, trying to make you to be knowledgeable and well equipped with knowledge about health so as to avoid sudden death. Now, on this week's episode, we have been talking about cardiovascular diseases, and I have spoken about coronary artery disease. I've spoken about hypertension. I've spoken about heart failure. I've spoken about arrhythmia. I've spoken about stroke. Now, in this episode, I will be talking about another type of cardiovascular disease. Another type of cardiovascular diseases. And on today's episode, I'll be talking about peripheral artery disease. Mind you, yes, I spoke about coronary artery disease. Now I'm talking about peripheral artery disease, PAD. Peripheral artery disease. What does peripheral artery disease mean? This is when the artery is supplying the legs, the lower limbs, have been blocked with fat, making blood supply there to be low, or blood is being pumped there with difficulties. This is when blood supply, the artery supplying the legs, the limbs, extremities of the body, the peripheral parts of the body is being affected, blocked by fatty tissues, making blood supply to that part reduce, or blood supply there low, or pumping with difficulties. In this case, it causes discomfort in the legs. Like you feel pains at the leg region. Sometimes some of the pains you feel at the leg region, maybe it's because of blood supply issues. But due to everybody has this notion of arthritis, every pain somebody feel, persistent pain, it is being categorized under arthritis. Please be sure to get a doctor's diagnosis before you conclude that you are having arthritis. Now, symptoms of this is called, these are the symptoms you will see, and you will know that you are having peripheral artery disease. One, you have leg pain or cramps, maybe during physical activities. During when you're doing any activity, maybe walking or something, you'll be feeling pain, you'll be feeling leg cramps, leg pain, you'll be feeling numbness or weakness of your leg. You feel that your leg is weak, your leg cannot carry you, your leg is paining you and is very weak, you cannot stand with the leg, you cannot make use of your leg properly. When you see that, or coldness on the lower leg or feet, when you touch your feet and your feet is cold, knowing that you're having reduced blood supply to your leg. Or you see sores on your toes or feet or legs that won't heal, sores on your toes, on your feet, or on any part of your leg, and that sore is taking time to heal. You are treating and treating and treating and treating, it's not healing. Go and see a doctor. That doesn't rule out the fact that there are sores caused by diabetic foot ulcer. It's what we call diabetic foot ulcer, but I won't dwell on that. I'm still going to talk about that when I'll be talking about diabetes. Now I'm talking about heart. I will still come back to talk about diabetes. And when I'll be talking about diabetes, I will talk about diabetic foot ulcer. There's another one like that. The next one we'll be talking about is congenital heart disease. When we talk about congenital, when you hear the word congenital, that means that person has that issue from birth. The person was given birth to with that. And congenital heart disease refers to structural heart defect present at birth. Maybe the person's heart, the baby's heart was not well formed, or had a lot of deformity while forming, it didn't form well. The child came out with the heart having a lot of structural deformity. That child has coronary heart disease. Even when you grow up as an adult and you have had that heart failure, heart problem from birth, it is called coronary heart disease. This can range from simple defects like hole in the heart to more complex conditions affecting the overall heart structure. You can have simple defect like hole in the heart, like people who used to have give birth to a child and the child has hole in the heart. The child having hole in the heart is not because the child pierced the heart or something, or maybe something they won't pierce the heart. No, that child's heart did not form where that part that is having hole did not form until closure. So the child is giving birth to its hole in the heart, or more complex heart issues whereby the whole heart was affected. These are conditions we call congenital heart disease. And the symptoms include the symptoms may the symptoms can vary depending on the type. Which number the common symptoms we have is rapid breathing, cyanosis. When you give birth to that child, you notice that the child is blue, bluish baby, skin blue, lips blue, nail blue, kind of blue instead of pinkish. This is your lips instead of being pink, it's shining blue. Your nail, tip of your nail, even here sef, if you look at it, instead of shining pink, it is shining blue. Or the feet shining blue. At that case, on the skin shining blue, in that case, we call it cyanosis. That is reduced blood supply to those parts of the body. When there's reduced blood supply, that means the heart is not really pumping blood to those parts of the body. We call it cyanosis. Fatigue, poor blood circulation, which will lead to that cyanosis. These are the symptoms of congenital heart disease. The last one I will talk about is what we call rheumatic heart disease. This rheumatic heart disease is caused by rheumatic fever, which result from untreated or inadequate treatment of strep throat. Now, this brings me to attention. I want to draw the public attention. Now, people used to suffer from sore throat. This sore throat is very common, and some people used to treat this sore throat with levity. Some people used to feel that it's normal thing. When it comes, it goes, and when it disturb me after a while, it will go. And they will not even take time to really treat this sore throat. We call it strep throat. Medical term is throat, which is sore throat. People don't used to take time to treat their sore throat properly, and they feel like they are doing themselves good. My brother, my sister, you're not doing yourself good. Sore throat is it's a very dangerous disease which people don't know, because sore throat can lead to heart failure. Yes, sore throat can lead to heart failure. That fever can affect the heart, and you have heart failure. Someone who was very healthy, but because of not properly treating your sore throat, you just develop heart disease overnight. So please, let's be careful with this sore throat. Treat it properly. When you discover you have sore throat, treat it properly. We have we have different medications you can take for sore throat. Please consult a medical doctor. I don't prescribe drug online here, so I won't talk about medications you take, but consult a doctor, consult a medical personnel, even a nurse, trained nurse, to give you medication for sore throat. Treat it properly. It can cause permanent damage in the heart valves. You see how bad this sore throat can be. So please don't minimize it. When you have sore throat, treat it properly. Signs and symptoms of this rheumatic heart failure include shortness of breath, chest pain, swollen joints, heart palpitation. These are the signs and symptoms of heart rheumatic heart disease caused by sore throat, rheumatic fever. That sore throat, if you notice, whenever you have sore throat, you have fever. That fever can cause heart failure. So please treat your sore throat properly. Treat your sore throat properly to avoid permanent damage that cannot be reversed. Thank you, and until we meet again, we are done with the different. For now, we are done with the different cardiovascular diseases. Now, what I'll be doing the next episode is to tell you the causes of some of these cardiovascular diseases, the things that can predispose you to cardiovascular diseases. In our next episode, I'll be talking about that. Take care of yourself, and I love you. Take care of your health. Bye.